Hello, I'm Dr Sharan. I'm one of the aesthetic doctors here at SkinViva, and today I'd like to talk to you about how to prepare if you've got an upcoming appointment with us. If your appointment is for a consultation where you're coming to discuss a potential treatment, the first thing I would advise you is just ask yourself a few questions about why it is you've booked the appointment. There will be certain things that have been bothering you about your face, and if it doesn't need to be too specific, but if you've got an idea, is it perhaps that you feel you're looking more tired, that you're looking a bit older, or something even more general that you just want to look as fresh as possible, come to us with that and just be honest with us, because once we've got that information from you, we'll be able to bespoke a treatment so that it suits your needs. In terms of the appointment itself, it doesn't matter if you bring a list of questions to us. We can go through those and we'll try and answer those to our best abilities. We'll discuss everything from the benefits to the potential side effects, and if there's anything that we haven't covered, please just feel free to ask us. If your appointment is for a treatment rather than a consultation, the first thing to think about is, have you timed the appointment appropriately? So for instance, if you've got an important event, it's a good idea to have a good window between your appointment and the event itself of perhaps a couple of weeks. The reason I suggest that is if you were to have any swelling or bruising, it's a good idea that that's all settled so that you're not feeling self-conscious on that important day. In terms of timing otherwise, you might have regular exercise classes that you like to attend. Think about all of that, because for the 48 hours post dermal filler or anti-wrinkle injection treatment, we don't like you to do things that are going to get you too warm. So no spas or steam rooms or exercise classes. So it might be that you need to postpone or cancel or even adjust your appointment timing with us. If you've had a drink of alcohol right before a treatment, it's not too much of an issue in terms of the treatment itself. However, you might find that you bleed a little bit more on the actual treatment day and that there's a little bit more bruising. After the treatment, however, it's a good idea to avoid alcohol for 48 hours, particularly with the anti-wrinkle injection treatments, just so that you get your best optimal result. As a side note, if on the day of your appointment you suddenly were to notice a cold sore and you have a planned lip enhancement treatment, please let us know. We would reschedule your appointment, and that's because we don't want to spread the cold sore virus across the area that we're treating. Also, if it's another area of the face and you happen to come up with a skin infection, again, it's best to postpone those treatments. So there are additional things to just have a little think about. Other things to think about on the day of treatment itself is that you want to ideally come with a makeup-free face. We are going to remove the makeup with wipes if you are wearing it, and the reason we do that is we want to minimize your risk of any skin infection. So if you've already not got it on, it reduces one step for you. But if you feel uncomfortable, then that's not a problem. Just come as you are, and we shall remove it once you're here. In terms of your medical history, we will want to take some information from you about that, just to make sure the treatments are suitable for you. So if you are on a list of medications, if you bring that with you as well, we can go through it all. Just check there's no interactions. We would never advise you to stop any prescription medications that have been prescribed to you by a doctor. However, there are over-the-counter medications that you might want to consider not taking. So for instance, if you had a headache a day or two before a treatment appointment, it's a good idea to avoid things like ibuprofen, aspirin, just because they can make you bleed a little more, and instead opt for something like a paracetamol. And that's it really. If you have any questions, we've got a really good customer service team and they'll be able to guide you a little bit further.